All right, so this video is going to demonstrate the use of Narcan or naloxone for a possible narcotic overdose. So the Narcan that we're going to carry is going to come in a little kind of peach-colored container with a piece of paper around it. Right? That piece of paper is our medication consent form. So when you're getting ready to administer it, or at least after you've administered it, this paperwork needs to be filled out. It's going to include the medication that you're giving, the dose that we're giving, lot number, expiration date, who's verifying the medication prior to administration, and then who we're administering it to. And then after we're done, we want to get consent for administration. You want to receive consent prior to administering it, and then at a minimum afterwards, get a signature from the patient okaying the administration of the Narcan. Right, so when you take your container, you're going to open up the peach box, and then inside of it, you're going to have kind of a yellow syringe, and you're going to have a glass tube with a red top on it. So this is our Narcan. So in order to set this up, we're going to pull the red top off, and we're going to pull the yellow flat top off the top side. Now be careful when inserting this. There is a needle inside of the syringe. So you're going to insert the glass syringe into the plastic syringe, and as soon as you feel it kind of stop, you're going to twist it. It'll twist about 1.5 turns, and it's locked in place now. All right, so once that's set up, you're going to remove from the package a mucosal atomizing device, an MAD. It's a little foam cone that we're going to attach to the top of the syringe. So the big yellow cap can now come off, and we're going to screw the mucosal atomizing device on, and we're now ready to administer our Narcan to our patient. Now when we administer Narcan, it's going to be administered intranasally, so up in the nose. With this particular style, there's 2 milliliters of liquid in here. So we're going to want to administer half of it in one nostril and then the other half in the other nostril. Doesn't matter which one you start with, but the procedure is going to be the same. You're going to go ahead and plug the nostril you're not going in. You're going to take the MAD and insert it into the nostril that you want to administer it. Now as you kind of look at this side, there's going to be numbers on here. You'll see a 0, 0.5, 1, and 1.5, and then all the way down would be 2. So as you push this in the nostril, you're going to push that down to the 1, and you should see a mist, or you should at least feel a mist coming out of the MAD into the nostril. You then go ahead and switch it to the other nostril, and then you're going to go ahead and push it, and you administer the other 1 milliliter into that nostril. Once that's done, you're going to go ahead and take your MAD along with your syringe, and you're going to put it into a sharp shuttle. So in the medication bag will be this little red top sharp shuttle. You open it up, take your MAD and syringe with everything together, just slide it in and go ahead and close it up. Now this sharps container will be dropped off, or should be dropped off, in the security office. Once you're done, remember to fill out the paperwork, and then once again, if your patient does come to, have them sign it. If your patient remains unconscious or unresponsive because we're administering it for a narcotics overdose, there is a spot here where it says reason is unable to sign. So under where it says reason the patient is unable to sign, just go ahead and write in that they were unresponsive or unconscious.